Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, I did promise you one more installment on antibacterial agents, but this class of drugs is a little different. These are the drugs that we use to treat tuberculosis. I've been teaching pharmacology now to dental hygiene students and dental students for close to 25 years. And so I try to give my students every advantage I can, including mnemonic devices and acronyms to help them remember certain key facts about pharmacology. So for these drugs, I'm going to use the acronym RIPE, RIPE, which stands for rifampin, isoniazid, pyrazinamide, and ethambutol. And I'm sure glad ethambutol came along because before then the acronym was RIP and that really wasn't so great. So what are these drugs? Well, they're used normally in group, right, as a cocktail to treat tuberculosis. Rifampin, the first, is bactericidal. But rifampin, while it may be great in killing the mycobacterium, well, resistance does develop quickly. And the resting bacilli are usually unaffected, which is how the resistance develops. Rifampin can cause GI distress, most notably nausea and vomiting, which can, if anybody's an expert on the ravages of gastric acid on dentition, that would be you. And it does cause a sort of red-orange discoloration to body fluids, including saliva. Isoniazid, well, that also is bactericidal in how it works because it dissolves the cell wall. It does do a great job in killing, but again, resistance can develop quickly. And isoniazid is different in that it has some significant adverse effects: peripheral neuropathy, insomnia, restlessness, and optic neuritis, which is normally treated with pyridoxine. Pyrazinamide, well, we really don't know how pyrazinamide works exactly, but we do know that it's often used in combination with isoniazid and rifampin for not as long, usually a few months. The problem with the pyrazinamide is, again, it has its adverse effects like nausea and vomiting, again, and arthralgia. Plus, in long-term exposure to pyrazinamide, many people develop problems with their liver, hepatotoxicity. So if they're taking other drugs that are metabolized in that same pathway, that could be problematic, especially for us in dentistry, since most drugs that we use in dentistry are metabolized in the liver and cleared through the kidneys. Well, what about ethambutol? Well, ethambutol is bactericidal as well. It impairs the cellular metabolism of the mycobacterium, but it too can cause GI distress, peripheral neuropathy, and even optic neuritis. So all told, all four drugs work very well together in treating tuberculosis, but they all have adverse effects which are difficult to overcome, and each one of them can have an issue when it comes to our practice of dentistry, not so much because our patients may be taking these drugs, but we, if we're exposed to tuberculosis, may be taking these drugs. And the last things we need as practicing professionals is peripheral neuropathy and optic neuritis. Well, that's it for this episode of Fast Facts Pharmacology. Look forward to seeing you at the next episode. In the meantime, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.